come in.
Hi, my name's Kayla. I'm going to be your nurse today. Can I get your first and last name and date of birth?
Pat Smith, 12/16/1965.
All right, check the bracelet. Your wristband matches with my mark. All right, so I'm going to go ahead, wash my hands. Raise my bed up. All right. Okay, I'm going to want to put on non-sterile gloves. Then I'll want to expose the perineal area, perform pericare on my patient. Then I'll want to remove my gloves. Okay, now I'm going to perform hand hygiene again. Put my patient's legs in the lithotomy position. Make sure to keep him covered. All right, now I'm good to go ahead and open up my catheter kit. All right, so this will serve as my garbage can at the end of my bed. This can be thrown away in my regular garbage. Okay, place this between my patient's ankles. Then I'll open away to the side. And towards myself. The first thing that I'll see in my kit is my sterile gloves, and I'll go ahead and set those to the side because I won't need them right now. Then I'll see my drape. All right, so I will want the shiny side down. So I'm going to walk towards the head of my patient's bed, expose the area. Okay, and this next drape we won't need, so we can throw that away in the garbage as well. All right, now it is time to put on my sterile gloves. Right, I'll want to do my non-dominant hand first. Then I'll have my one adjustment. And I'll want to grab underneath the cuff. Bring my kit. Oh, then I can readjust my sheet. Make sure it's all the way under. Right, then I'll grab my kit, place it in between my patient's legs. I can go ahead and take out my specimen cup because I won't need that. And then I'll go ahead open up my lube. Squirt it into my tray. Go around to my garbage can. Go ahead, open up my iodine cloth. Them on my tray, around to my garbage. Okay, now I'm going to go ahead and remove the packaging off of my catheter, making sure not to go outside of the sterile field. And that can go ahead and go back in, around to my garbage can. All right, then I will uncap my sterile syringe around to my garbage can. Connect my syringe. Well, first, before I connect it, I'm gonna want to note how much water is in it. Then I'll go ahead, connect it to the port, and then it can go ahead and sit right there. Then I'll want to use my forefinger and my thumb, and I'm gonna grab my iodine swab. I'm gonna go from the top all the way to the anus, furthest side from me, around to my garbage. Closest to me from the top to the anus, around to my garbage, and then right down the urinary meatus to the anus, around to my garbage. All right, keeping my finger here, I'm going to grab my catheter, going to lubricate it. Okay, then I'm going to start inserting about 3 to 4 inches, or until I see urine flowing into the tubing. When I see the urine start to flow, I'm going to insert another inch. I'm going to slide my fingers down, hold on to my catheter, and put my sterile water into the catheter. Check for resistance. This would go into the sharps container. All right, then I'm going to go ahead, take off my sterile gloves, and I would throw them into the garbage. I'm going to go ahead, wash my hands. Put on a new pair of gloves. Then I'm going to go ahead and attach, I'll remove my tray first, and that would go ahead and go right to the garbage too. Grab my bag out, attach the catheter at the Y port to my patient's leg. The tubing should be over the leg. Unfold the bag and connect it at the bottom of the bed here on the hook. Okay, I will clean up all of my garbage. Put my patient's legs down, making sure that there's enough slack so they can move. Perform peri-care on my patient. Remove my gloves. Sanitize my hands again. Cover my patient up. Throw away my garbage. Lower the bed. Ask my patient if they need anything before I leave. He didn't, so I would hand him his cola just in case he does in future. And then I would go ahead, wash my hands one more time, and then I'm able to leave the room.
Come in.
Hi, my name's Kayla. I'm going to be your nurse today. Can I get your first and last name and date of birth?
Pat Smith, 12/16/1965.
All right. Check your bracelet and what you said. They both match with the mark. So I'm first going to go ahead and sanitize my hands. Going to raise his bed up. want to check the bag. And it is full of urine, so I would want to go ahead and dispose of the urine before I remove the catheter. Okay. Right, and I will want to expose the area that needs to be exposed. Perform hand hygiene. Put a pair of non-sterile gloves on. Then I'll want to place the towel down in between the patient's legs to protect the linen. Right. And I will grab my sterile syringe. Connect it to the green port. And I'm going to remove all of the water that I have noted that was put into the balloon in the catheter. Alright, now that I have all the water removed, I'm going to have my patient take a deep breath in and out, and I will remove it. We'll want to remove the syringe, put it in the sharps container. And all of this will be disposed of in the biohazardous trash can. Alright, now I'm going to go ahead, perform hand hygiene. Then I'm going to want to put on a pair of non-sterile gloves. Alright, and then I would perform pericare on my patient. When I am all done, I would remove the towel, dispose of it in the dirty linen bin, remove my gloves, throw them away, perform hand hygiene once again, cover my patient back up, alright, then I would go ahead, lower his bed, ask my patient if he needs anything before I leave. He didn't, so I would hand him his colic just in case he does. I would go ahead, leave the room. After washing my hands, document, and then come back 2 hours later to make sure that he is able to urinate on his own.